Jainism, in Chinese religion, you would find that there are set of rules and regulations that are given for people who are would say married people who are living a normal life. For them, there is a set of rules and regulations, and people who are sannyasis, people who are muni, they call them as a muni. For them, they have a rigorous spiritual penance kind of techniques, and there they do fasting, and in that fasting they consume their own self urine. It is called as a vishesha pratijna. They do the sankalpa for doing fasting for a longer duration, and in that process they often use the urine for as one of the tool. In Buddhism as well, we see there are certain references found in there is a one thing called as a Mahavagga. Lord Buddha advises to drink one's own urine when there is a snake bite. The ancient text called as a Hevaraja Tantra says if the urine is consumed with certain herbs, it can stop aging, and even that death will be troubleless. Olden Buddhist people used to live more than 150 years by drinking self urine. So if you see the people who have lived more than 100 years, you would find in some other way they have used urine in their life. In India, the various sadhus like Shaivas, Aghoris, Nagas, Lamas, Vairagis, all of those sages and yogis most of the times use urine for their own spiritual development. Not only in we find references of urine therapy in Jainism, Buddhism and Hinduism, we find its references in Islamic texts. Well, I couldn't translate this fully in English, but there is a reference there. I'm not very sure about its authenticity, but whatever that I could gather, there is a reference which says that Muhammad Paigambar and his one of the followers had instruction given to someone saying that you can use your own urine for healing. So in Islam it is considered that urine is absolutely haram, means you cannot touch. Even if you touch the urine, you have done a big sin. That's how it is considered. But in there is one reference which says that you can use, and in our center we have seen many people who are followers of this particular religion often come for therapy. There are references that are found in Bible as well. So in Christianity, Bible is considered to be the most highest scripture. That is the one which gives us the laws of practices and the philosophy of our life in Christianity. And there is a sentence that comes, drink water out of thine own cistern and running water out of thy own well. How this was discovered, how it came, we shall discuss further as we progress. So just to tell you that urine therapy, or the whatever that we are talking about, Shivambu Chikitsa, or in other words we call it as a Amroli, has such a wide references. It has a traditional basis. But recently urine therapy has come into talk because of some people, and there are some people who have worked towards this. If you see recently who are the people who have contributed to make this therapy come alive and make it popular, there comes a person who lived in UK and US by name J.W. Armstrong. This man in 1950s and 60s, since there was a Second World War happening, and at that time we know there were the epidemics of various types of infectious diseases that were happening, and this person himself suffered from an illness called as a tuberculosis. He tried so many therapies. Despite of that, it did not help him. As a result, he got also a trouble like asthma. He became allergic, and also later on he developed a diabetic tendency, because of which his life was totally crippled. He was depressed, And since he was a religious follower, always he used to read the Bible. One fine day when he was reading the Bible, his mind got stuck with that earlier line which we had discussed just now. He said, what is the meaning of this? It says that drink the water of your own body. What it means? Then he started drinking his own urine. He did this experiment for himself, and maybe he got some references from his ancestor people. They told him that urine could be used this way, because that is the way this therapy has been communicated orally. And from his elderly people, he understood its procedure and he started using it. And he used it almost for 40 days. He did fasting as well as urine for 40 days. And to his miracle, his diabetes and even the tuberculosis was healed. His trouble was healed to greater extent. That was a miracle which happened in his life, and that was something which is astonishing to him and to his family members. And that's how many people started coming, because that time the medical science had not developed to this extent, and everybody was helpless and in need of some treatment. And people started coming to him, and he started guiding them that I did this way, you also can do. And interestingly, this man documented most of the cases, and in that time he has documented more than 40,000 case histories, and he treated many people with the urine therapy, and he wrote a book called as Water of Life, which is present, even available today. On any search you would find it online. And very interesting book which talks about various testimonies, and it talks about how the Armstrong did his experiments. Then later on, interestingly, there is another person by name Ravjibhai Patel from Gujarat. He was an Ayurvedic practitioner. He himself suffered from heart disease. He had problems with his coronary arteries, and he was even again asked for surgery, but he followed this therapy, and he recovered, out of which he gained the interest. What is this? What are these bases? And he tried to gather all those, he compiled many of the traditional references which we had talked just now. Then there is another interesting person by name Shri Morarjibhai Desai. He was the Prime Minister of India, who lived almost 100 years, very healthy and absolutely a diseaseless life. We can say he had a very natural death. Almost somebody would have death because of some illness, but he was the one who had very, very sound and healthy life throughout. And interestingly, though he was of age of 100, he never looked of that age. He looked always younger. There are many stories about this person, and he never changed. Though he was in politics, he never changed his statements. He stood to his words. He said, yes, the secret of my health is urine. Even though when he was taken to hands when he went to US, and there were so many reporters who asked him, you being a prime minister of such a country, you are talking this nonsense. Like that was questions were asked. Even then he stood to his words, and he said, yes, this is what I have been practicing, and these are the benefits which I have gained from this therapy. Then very interestingly, I couldn't get the picture of Swami Satyananda Saraswati. In yoga, this name is taken as with a great reverence, and all of us, we know in Indian schools, one of the popular and the traditional school is the Bihar School of Yoga. And from Bihar School of Yoga, Swami Satyananda Saraswati was the one who said that the practicing or drinking one's own urine is a yogic technique, is a technique called as Amroli. And that's how he wrote one book. There is one book called as Amroli, which describes how urine could be used as one of the agents in yogic kriyas. And he talks in great detail how urine therapy could be used for spiritual development. So there are references. Recently, there are few people who have done a very extensive work towards this therapy. One among them is a lady by name Martha Christie. This lady had a problem with her uterus. There was malignant growth in her uterus. She, as we know all, whenever there is a cancer, all of us we rush for 3 therapies. One is either surgery, second is chemotherapy, or a radiotherapy. I believe, I don't remember fully, but her story is available on the internet. If you give a click, she has a story named as the untold story of my life, or something like that. Very interesting story she has. And she says she suffered from this illness. She tried so many therapies, but even then she was depressed and her illness was growing and growing. It was metastasizing everywhere. And then she happened to come to know about urine therapy. She followed the urine therapy, the diet and the lifestyle that was told there very religiously, and her reports, most of the reports almost came normal. And that was something which shaken her. And then she, being again, she was a homeopathic practitioner, she decided, I want to go to its roots. I want to find out what is that is there in the urine which makes us healthy, or what is that is there in the urine which is medicinal in its kind. So she has done a lot of compilation, and she has gathered a lot of information, and she has put it in a book called as Your Own Perfect Medicine. The people who have a scientific bend of mind, who want, no, okay, traditional references are fine, but I want to know what modern science says about urine therapy, you would get the answer in this particular book. Of course, there are people who promote and propagate this therapy without any expectations. There is a group of people, there are various foundations, there are various organizations which help to promote this therapy and spread this therapy, is only with the intention that this is a therapy which requires no cost. This is such a therapy that you require no cost, one thing, and it has no adverse effect. So one can guarantee that you would have benefits or not, you will get the benefits or not, we cannot assure, but we can assure definitely that by doing this you are not going to have any adverse effect. So there are many conferences that are organized all over the world. There are many groups, and almost now more than 7 international conferences have happened in field of urine therapy. Having heard all these things, I believe some kind of acceptance at least must have come in your mind. At least you are ready now to listen to this thing, that okay, let's know more about it. Let's know, is it true? Okay, traditional people were following it, many religious texts talk about it. Now really? So, but still we are in 21st century, our scientific mind wouldn't accept it. What you're talking? Drinking urine? How is it possible? But to tell you, urine therapy has been explored very extensively by modern scientists. But unfortunately, we do not know. Even the modern medical doctors, many of the medical doctors do not know from where these all modern medical drugs are being manufactured. So urine therapy is not only has a traditional and scriptural basis, but it has evidence. It is an evidence-based therapy. During 1940s to 1980s, if you do the literature survey, if you do the literature scan, thorough literature scan in science, you would find that there are many research articles that are published in leading medical journal which says that urine contains many important ingredients which could be used as medicine. There are certain journals like Journal of American Medical Association, Science, the British Medical Journal, all these journals, these are few pictures I have put, there are plenty, which say that urine contains very vital ingredients. One of the pharmaceutical giant company says that urine is like a gold mine. Why they say? Because they have searched these kind of ingredients, but unfortunately what they have made products out of it, and they are selling it. So that's why he says, and there are hundreds of vital ingredients from urine which have been searched, which are presently used in modern medical science or allopathic medicines, which I'll there is a huge list. We shall take a few most popular medicines that are used today. One among them is urokinase. So medicines which are extracted from human urine, which are commonly used. In my understanding and whatever information I have able to gather, there are about 44 types of medicines that are commonly used in modern medical practice, which are extracted from human urine. We shall take few of the examples. One is the urokinase. Urokinase is an injection. It is also called as a streptokinase. It is a kind of enzyme, amino acid, extracted from the human urine, used in coronary artery disease, or even whenever there is a blockages in the blood vessels, this particular injection is used. Suppose if I get in a cardiac arrest, we would immediately go to the hospital, and after reaching there, immediately they won't operate. The person needs to be stabilized, his vital signs needs to be stabilized, his heart needs to be getting normal blood flow, and then they would go for further permanent surgeries. But during that process, they use these medicines which help to make our blood thin, and it removes the blockages from the blood vessels. Even it helps to dilate the blood vessels, thereby recovering that person from that emergency situation. And that particular injection is used for cardiac and cerebral infarction. Infarction, we have discussed a few days back what is infarction, and that is where it is used. If you go to a medical store and if you ask the ampoule of this particular medicine, and if you remove there will be a page inside. If you remove that and if you read on that, it is clearly mentioned that this is an extract of human urine. And the cost of this medicine in Indian rupees is small ampoule cost about 15 to 13,000 rupees, which is a life-saving medicine extracted from human urine. Earlier, this medicine was manufactured by companies like Pfizer. Now there are many companies which have come. Now that patent laws have come out. So now the cost has come down, but this is the one which is. There is another medicine which is searched and discovered by Chinese scientists. I happened to meet this Dr. Louis. He had come to Germany, and in his presentation, a very beautiful presentation he had made, because he had done a lot of animal studies, and he presented an ingredient called as this is a very big name called as it's a chemical name. In a short form, they label it as a CDA2, and this is an injection which smartly kills the cancer cells. That's what is his claim. Generally, for cancer treatment, we use chemotherapy, and chemotherapy is not a specifically targeted therapy. Like if I have a tumor somewhere suppose in the breast, and if I take a chemotherapy, the chemotherapy is affecting on all the cells that are there in the body. It is not only just affecting on the cancer cells. It is affecting and maximum proportion of our body contains normal cells. So destruction of normal cells is more compared to the cancer cells. That is the problem with the chemotherapy. And he says this particular medicine which he has able to extract from human urine, he says it goes, first it identifies the cancer abnormal cell and it binds with that and it destroys it. He is doing a lot of work on it. He presented his papers and work there. He showed how about 8 centimeter tumor could be reduced almost to null within 45 days of treatment. And he says that is because of CDA2, and CDA2 is extracted from human urine. There is another gonadotrophic hormone, and this is a brand name or the medicine. And this gonadotrophic hormone is used generally in menopausal syndrome. The ladies who are reaching the menopause often tend to have so many physiological changes, psychological changes, and for that they use this hormonal treatment, and this is also extracted from human urine. Also used to enhance the ovulation in females and even for sperm genesis in gents. So in a males who have less sperm count, for them they use this gonadotrophic hormone, and these all medicines are extracted from human urine. There is another medicine called as metrodin, prophecy, antineoplastin. Metrodin is used in menstrual dysfunction. Most of our gynecologists use this medicine, very commonly used. Prophecy is used to stop the repeated abortions and miscarriages. Very commonly used. One simple ampoule costs more than 1,000 rupees. And all this this is used for infertility, people who have problems with conception. All this is again extracted from human urine. Very interestingly, there is one more ingredient that is found called as antineoplastin, prevents selectively the growth of cancer cells without harming the growth of healthy cells. And I'm not just talking. Here are those actually branded medicines that are commonly used today everywhere. Medicines that are extracted from urea. Most of the times people say urine contains a thing called as a urea, and urea is something which is problematic. But you will be amazed to know that even the urea, if the urea is taken to the amount of 3 to 5 grams, it has no adverse effect. There are studies. Very interesting to know this. There are few. Why I have put this slide is because here there are many ladies and who often use various types of creams, particularly the cosmetic creams. And there are few products that are available in the market which are extracted from the urea, and this urea is again from the urine. Urofil is another medicine that is extracted which contains urea and is diuretic in action. So it enhances the urination. This is again another follicle stimulating hormone. Maybe tomorrow, if we find the time, we shall discuss about various hormones, endocrine system, and in that we shall understand what is this follicle stimulating hormone. But again, this is extracted from the human urine and used to assist the ovulation and fertility. This is another cream which is used in skin problems. This is another cream or ointment which is used as an antiseptic in the management of chronic wounds. So these are all products that are available in the market.